It's 2 in the morning and you're wide awake again, walking to the bathroom for the second, maybe third time tonight. You tell yourself it's the glass of water before bed, or your age, or just bad luck. And most of the time, that's exactly what it is. But for a smaller number of people, this nightly pattern is one of the earliest signs that the kidneys, the two organs quietly filtering your blood around the clock, are starting to work differently than they used to. Tonight, we're going to walk through exactly what's happening in your body when this starts, which causes are common and harmless, which ones are worth a real conversation with a doctor, and how to tell the difference. If you've been dealing with this for months, you've probably already tried the obvious fixes. Less water after dinner, no coffee past noon. Maybe you've even started rationing what you drink in the evening, only to still find yourself awake at 1 a.m., then again at 4. That's frustrating in a very specific way, not just because of the lost sleep, but because it can feel like your own body has started keeping secrets from you. Here's something worth hearing clearly at the start. Waking up once to urinate is common and, for most adults over 50, considered within the range of normal. The body's nighttime urine production genuinely does change as we age, and that alone explains a large share of what people experience. But when it becomes 2, 3, or more times a night, every night, it stops being background sound and starts being information. Information your body is giving you about how several different systems are working together. Kidneys, bladder, hormones, heart, even how you sleep, they all play a role. And unpacking which one is driving your particular pattern is exactly what we're going to do. Let's start with the basics of what's actually supposed to happen. During the day, your kidneys filter blood and produce urine at a fairly steady rate. At night, a hormone called antidiuretic hormone, or ADH, normally rises, signaling the kidneys to concentrate urine and produce less of it, which is exactly why a healthy young adult can sleep 7 or 8 hours without needing to get up. But here's what most people don't know: that nighttime rise in ADH tends to blunt with age. Many people over 60 simply produce more urine overnight than they did at 30, even if everything else in their body is functioning normally. This condition even has a name: nocturnal polyuria, and on its own, it is not a disease. It's closer to a predictable shift in one hormonal rhythm, similar to how sleep itself gets lighter and more fragmented with age. This is important context because it means the starting assumption for most viewers should not be alarm. Almost nobody realizes that this single hormonal change accounts for a meaningful share of nighttime bathroom trips in older adults, independent of any kidney or bladder problem at all. That said, this baseline shift interacts with several other systems, some completely benign, some worth watching more closely, and that's where the real detective work begins. The next question is one your doctor would likely ask first. Is this a bladder problem? Or is your body actually producing more urine overnight? There's a meaningful difference between a bladder that can take to the joljerns, to the tenrestaves, to the joljernsstades unlenedic to the joljernsstays. A meaningful difference between a bladder that can hold much urine and kidneys that are producing too much of it overnight, and this distinction shapes almost everything that follows. For men, an enlarged prostate, medically called benign prostatic hyperplasia, or BPH, is one of the most common reasons for frequent nighttime urination. As the prostate gland enlarges with age, it can press against the urethra, making it harder for the bladder to empty completely. The result is a bladder that feels the urge to go again soon after the last trip, even overnight when urine production has slowed. For women, overactive bladder becomes more common with age, partly related to hormonal changes after menopause that affect the tissue and muscles supporting bladder function. The bladder itself may start signaling urgency even when it isn't especially full. Here's where it gets interesting for both groups. If the issue is primarily about bladder storage rather than kidney production, the trips to the bathroom often produce relatively small amounts of urine each time, and there may be daytime urgency too, not just at night. That's a genuinely useful thing to notice about your own pattern, because it's one of the first questions a doctor will ask, and most people have never paid attention to it before. By contrast, if each nighttime trip produces a normal or even large volume of urine, That points away from a simple storage problem and back toward the kidneys and hormones, which brings us to the everyday factors that can quietly amplify nighttime urine production, sometimes without you realizing it. This next one catches almost everyone off guard. Several very common habits and health cost conditions can increase nighttime urine production directly, independent of aging or the bladder. Fluid timing is the most obvious. Drinking large amounts of water, tea, or other fluids in the few hours before bed gives the kidneys more to filter overnight, regardless of how well those kidneys are working. Alcohol and caffeine make this worse in two ways. They add fluid volume, and they also suppress ADH, the same hormone we talked about earlier, which further increases urine output. A glass of wine with dinner and coffee after it can genuinely add an extra bathroom trip that has nothing to do with any underlying disease. Certain medications matter too. Diuretics, commonly prescribed for high blood pressure or fluid retention, are designed to increase urine production, and taking them late in the day rather than the morning is one of the most common and most fixable causes of nighttime urination. This is worth mentioning directly to a doctor or pharmacist, since a simple timing adjustment can sometimes resolve the issue without changing the medication itself. Then there's diabetes. When blood sugar runs high, the kidneys filter out the excess glucose, and that glucose pulls extra water into the urine along with it, a process called osmotic diuresis. This can cause noticeably increased urination, both day and night, along with increased thirst. For someone who hasn't been diagnosed with diabetes, new or worsening nighttime urination, paired with increased thirst and unexplained fatigue, is a combination worth mentioning to a doctor specifically, since it can be an early clue that blood sugar needs to be checked. Almost nobody realizes how much these everyday and metabolic factors overlap with what people assume is just kidney trouble. In many cases, adjusting fluid timing, reviewing medication schedules, and checking blood sugar resolves the issue entirely. But there's one more system that connects to all of this in a way most people never expect: the heart. During the day, especially if you're on your feet, gravity causes some fluid to pool in the lower legs. At night, when you lie down, that fluid redistributes back into circulation, and the kidneys respond by processing and eliminating some of it, which is one more reason urine production can rise overnight. In people with heart failure or significant venous insufficiency, this effect is amplified. The heart's reduced pumping efficiency means more fluid tends to accumulate in the legs during the day, and more gets mobilized and filtered by the kidneys at night. This is why swelling in the ankles or legs, combined with new or worsening nighttime urination, is a pattern doctors pay close attention to. The kidneys aren't necessarily the primary problem here, but they're responding to what the heart and circulation are doing. Sleep apnea adds another layer that's easy to overlook. During apnea episodes, oxygen levels drop and pressure changes occur in the chest, which can trigger the release of a hormone that increases urine production. Part of why people with untreated sleep apnea often report frequent nighttime urination alongside loud snoring, gasping, and daytime exhaustion that doesn't match how many hours they slept. A brief but important note here: if nighttime urination is accompanied by sudden, significant leg or ankle swelling, shortness of breath, especially when lying flat, or chest discomfort, that combination warrants prompt medical attention rather than waiting for a routine appointment, since it can reflect how the heart is handling fluid. What researchers found next was unexpected to a lot of people. This heart-kidney-sleep relationship works in both directions, meaning treating sleep apnea or managing heart function often measurably reduces nighttime urination as a side, which is a good sign that the two are connected in that particular case. But we still haven't addressed the question this whole video is built around. What does it look like when the kidneys themselves are the primary issue? This is the piece most people are really here for, so let's be precise about it. Healthy kidneys don't just filter waste. They concentrate urine overnight, producing a smaller volume of more concentrated urine while you sleep. When kidney function starts to decline, one of the earliest changes is a loss of that concentrating ability. The kidneys begin producing urine at a more constant rate around the clock, rather than slowing down at night the way they're supposed to. In practice, that shows up as needing to urinate multiple times overnight, often with urine that looks pale or dilute rather than concentrated. There's one detail most people miss. This pattern frequently shows up before more obvious kidney symptoms appear, because the new kidneys are remarkably good at compensating for a long time before major symptoms emerge. That's exactly why nighttime urination gets flagged as an early warning sign rather than a late one. Other clues that can point specifically toward the kidneys, especially in combination, include unusual fatigue, swelling around the eyes or ankles, foamy or bubbly urine, unexplained changes in appetite, and blood pressure that's become harder to control than it used to be. None of these individually proves a kidney problem. Several overlap with the causes weird, but the combination is what matters. A doctor evaluating this would typically start with a simple blood test for kidney function and then a urine test, both of which are quick, low cost, and give a clear answer. It's worth saying plainly, nighttime urination alone does not mean you have kidney disease, and there is no way to know for certain without those tests. What it does mean is that this symptom, especially when it's new, worsening, or paired with any of the signs we just covered, is exactly the kind of thing worth bringing to see your doctor, rather than working around indefinitely. So where does that leave you? If you've been waking up once a night, that's likely just the normal hormonal shift that comes with getting older. Nothing to lose sleep over, so to speak. If it's become several times a night, especially if it's new, if it's paired with swelling, unusual thirst, fatigue, or urine that looks different than it used to, that's worth a conversation with your doctor. Not out of fear, but because the tests that would clarify this are simple, and catching a kidney or heart-related cause early genuinely changes what happens next. Your body has been sending you information for months, maybe longer. Tonight's video is really about learning to read it accurately instead of either ignoring it or assuming the worst. If any part of this matched something you've been experiencing, tell us in the comments. Which of these causes surprised you the most? And if you found this helpful, subscribing means you won't miss the follow-up video where we'll walk through exactly what to expect at that first doctor's appointment, test by test. Take care of yourself, and we'll see you in the next one.